Narration: this oral suspension is used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. It can also relieve symptoms of extra gas, like belching, bloating, and feelings of pressure/discomfort in the stomach/gut. Simethicone helps break up gas bubbles in the gut, while the aluminum and magnesium antacids work quickly to lower the acid in the stomach. It works only on existing acid in the stomach and does not prevent acid production. It may be used alone or with other medications that lower acid production. If you are self-treating with this medication, carefully read the package instructions before you start using it to be sure it is right for you. Some products have similar brand names but different active ingredients with different uses, so be sure to ask your pharmacist if you have any questions about your product or its use. When taking Antacid Antigas 200 mg, 200 mg, 20 mg/5 ml oral suspension, it is recommended to take it by mouth after meals and at bedtime as needed. Make sure to carefully follow the directions on the product package or as directed by your doctor. If you have any questions, it's best to consult your doctor or pharmacist. For those taking the chewable tablets, it's important to chew thoroughly before swallowing and then drink a full glass of water. If you are using the liquid form, be sure to shake the bottle well before pouring each dose and measure the dose carefully using a medication spoon/cup. It's important not to use a household spoon as it may result in an incorrect dose. Refrigerating the suspension may improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, although you can mix your dose with a little water if necessary. It's important to be aware that this product may interact with other medications, such as digoxin, iron, pazopanib, tetracycline antibiotics, and quinolone antibiotics like ciprofloxacin, preventing them from being fully absorbed by your body. It's best to discuss with your doctor or pharmacist how to schedule your medications to prevent this problem. If your acid problems persist or worsen after using this product for 1 week, or if you suspect a serious medical problem, seek medical help immediately. If you are using this medication regularly on a daily basis for more than 2 weeks, it's advisable to consult your doctor to determine if a different treatment is needed. Some side effects of this medication may include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, contact your doctor or pharmacist. The magnesium in this product may cause diarrhea. Using an antacid that contains only aluminum along with this product can help control diarrhea. The aluminum in this product can cause constipation. To minimize constipation, drink plenty of fluids and exercise. Diarrhea is more common with this product than constipation. If your doctor has prescribed this medication, they have determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Aluminum-containing antacids bind to phosphate in the gut, which can cause low phosphate levels, especially if used in large doses and for a long time. Contact your doctor immediately if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Contact your doctor immediately if you experience serious side effects, such as dizziness, fainting, slow/shallow breathing, slow/irregular heartbeat, mental/mood changes, deep sleep, or pain with urination. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. In the U.S., contact your doctor or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, contact your doctor or report side effects to Health Canada at 1-866-234-2345. Before taking Antacid Antigas 200 mg, 200 mg, 20 mg/5 ml oral suspension, make sure to inform your doctor or pharmacist if you have any allergies to aluminum hydroxide, magnesium, or simethicone, as this product may contain inactive ingredients that can cause allergic reactions. If you have health problems such as frequent alcohol use, dehydration/fluid restriction, or kidney problems, it's important to consult your doctor or pharmacist before using this product. Additionally, if you have phenylketonuria, PKU, or diabetes, or if you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor before taking it. It's essential to follow your doctor's recommendations for the best time to take this medication and to discuss the appropriate daily dosage for your specific condition. It's important to be aware that this medication can interact with other drugs and potentially affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are phosphate supplements, such as potassium phosphate, sodium polystyrene sulfonate. Antacids can also interfere with the absorption of many other drugs, so it's important to check with your pharmacist before taking antacids with any other medication. As for the best time to take this medication, it is typically recommended to take it after meals and at bedtime. The dosage and frequency will depend on your medical condition and response to treatment, so make sure to follow the instructions from your doctor or pharmacist. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to keep all your medical and lab appointments while taking Antacid anti-gas 200 mg, 200 mg, 20 mg/5 ml oral suspension. In addition to taking this medication, you may also want to consider making some lifestyle changes to help increase its effectiveness. This can include participating in stress reduction programs, quitting smoking, limiting alcohol intake, and making changes to your diet, such as avoiding caffeine, fatty foods, and certain spices. Be sure to talk to your doctor or pharmacist about any lifestyle changes that might benefit you. If you are taking this medication regularly and forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Antacid anti-gas 200 mg, 200 mg, 20 mg/5 ml oral suspension, it's best to keep it at room temperature away from light and moisture. If you prefer, you can also store the liquid product in the refrigerator to improve its taste, but be sure not to freeze it. It's important to keep all medications out of reach of children and pets. When it comes to disposing of this product, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, be sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.